Apologies, guys. I'm sorry you had to rejoin again. There's a trouble with network and the internet. I'm not my usual location today, so please come back and join so that we can start and talk about the different surgical procedures. I'll go back to what I was talking about. Is it the vaginal area? What do you call how?
External female genital structure.
Yeah, so the external female genital structure, that's your labia. Your labia, yeah? Labia. Sorry, guys. Your labia, your... Please actually interject because I don't know what... Yes, it's not my everyday thing. I don't look at it all the time, guys. Like I said, I'm the 80s kid who doesn't need to put pure connection again. We paused again. Sorry, guys. I don't know why we have poor connection and we're using bundles, we're not even using internet. So we'll go straight into the different procedures, the different surgical procedures. We'll start with the hymenoplasty, guys. It's not my area of specification. Actually, you need to take over this live. Go with it. So we're talking about the hymenoplasty. Please explain to them what that's about.
So hymenoplasty is a surgery that is used to reconstruct the hymen. So for those who have had damage on their hymen, either through sexual intercourse or FGM or any other kind of trauma, maybe you had an accident, or maybe there was an object that was inserted like during assault. Yeah, anytime the hymen is broken and it needs to be reconstructed, then you can surgically reconstruct it using a hymenoplasty. And the majority of patients that we get in Kenya who want hymenoplasty do it because of religious and cultural reasons. And the aim is basically to be able to, when the aim is religious and cultural, the aim is to be able to have some form of blood loss during penetration. Right?
So in short, it's about you being a virgin. That's why you're trying to sugarcoat it. It's about you being a virgin. Because sometimes culturally, religiously, if you do get married, the ritual of the first time you do have sex, aunties, people need to see blood. Yes. So that's what Dr. is talking about.
Yes. So that's what a hymenoplasty is. And what we do is we try to get the remains of the hymen and we reconstruct them so that you can have an intact hymen. And we even have pictures for that here. I don't know if you'll be able to see them, and I'm really sorry if they're too graphic for you.
Apologies, guys. This is a bit graphic, but then these are our body parts, yeah. So I don't know if this.
Yeah, I think we need to go a little bit closer.
Okay.
So if you can see, this is the surgical reconstruction of the hymen. As you can see here, the opening is quite large, and this is after the surgery where it's quite small. And these are just some more pictures of just some complications that can happen. But basically, this is what you start out with, and this is what you want it to look like in the end.
So other than the traditional and the cultural concept of being a virgin, is there, for example, another reason why you'd want to have the surgery? Could it be maybe I have many children and maybe I've had sex a lot and the area has become bigger? I'm looking for words for these things.
Okay, so for a hymenoplasty, no. One of the other reasons why women do it is basically to offer their spouses a gift, like as a revirgination. So that's something.
What do you mean a gift? You mean I am married and then after 10 years I do this surgery to offer you a gift?
Well, there's that. Or you maybe have a new partner,
Oh, yeah, you need to be brand new. Hey guys, so we are back. It was poor connection. So Dachari was saying you can do this surgery as a gift to your partner. Explain that a bit.
Yeah, so basically if you have a new partner and you want to do a revirgination, some women decide to give it as an intimate gift to their partner. But I can tell you that majority of the reasons are religious and cultural for hymenoplasty.
Where you get married and being a virgin is
very necessary.
It's very necessary and important. For this procedure, Daktari, is this an aesthetic procedure, or does this if, for example, I want to do it, maybe like you said, a gift to my partner, does it mean my vagina will be tighter? Does it increase pleasure for me?
Okay, actually that's a really good question, because hymenoplasty is not a vaginoplasty. It does not make the vaginal opening or barrel tighter. It just it returns the ring at the opening of the vagina. So
this.
The opening will be tighter, but the entire vagina, if you've been having sexual intercourse for a while, is not going to be the way it was prior to sexual intercourse. So for tightening of the vagina, we have non-surgical options like the radiofrequency, the EVA treatment, or we have surgical options where you do a vaginoplasty.
Yeah. So this has nothing to do with pleasure. This has something
or
looks. It's not aesthetic. It's just the fact of being a virgin. It's the fact of that is it a hole? What do you call it?
Yes, the hymen, the bleeding mostly.
The bleeding that you're a virgin and you've never had sex before. So I always say to each their own. I will say it again, to each their own. If you want to give a gift, well and good. Secondly, we're going to talk about the second surgical procedure, which is vaginoplasty.
Yeah. So vaginoplasty is any surgery that tightens the vagina. And some of the reasons why you may want to have a vaginoplasty is maybe you've had several vaginal deliveries, or maybe you haven't had several, you've had maybe one or two, but they were very dramatic, they were very traumatic, and you had an episiotomy, or you had any kind of perineal injury that was not repaired properly, and then now you need to either have that reconstructed or the tightening, or you've just noticed a lot of laxity after having babies or with aging, or with certain kinds of sports. So you have a lot of vaginal laxity, meaning looseness, and you're not able to feel your partner and vice versa. And so for that, you may want to have a vaginal tightening. Remember, there are non-surgical options for this, like for a hymenoplasty, clitoroplasty. There are no non-surgical options. But for a vaginoplasty, you can do it non-surgically using radiofrequency energy.
EVA treatment.
The EVA treatment. Please find out about it at Alora Medical Practice. You don't have to have surgery, and you can still have very, very effective tightening. Or sometimes when the trauma or the damage was so bad, then you can have a surgical tightening of the vagina, which is a vaginoplasty.
Exactly. Sometimes, women don't do a vaginoplasty just for the sake of pleasure. Yeah. Like Daktari said, some pregnancies, some conditions are very traumatic, and you actually do need a vaginoplasty for good reason, And as always, I say, before you do any surgical procedure, please go see an expert, see a professional, seek first and second opinion. But for me, my biggest question is, if you get a vaginoplasty, especially if it's necessary, does it increase the sexual pleasure?
Yes, it does.
That is the point I was looking for.
It does for your partner, and it does for you. Because for us to be able to increase sexual pleasure, we need to be able to have the laxity removed. We need to be able to have sufficient lubrication, and we need to be able to have an orgasm. So at least, if nothing else, you'd have addressed the tightness part of it, and then now you need to, if you have a problem, depending on whether you have a problem or not, you can address the lubrication and the orgasm. So yes, it will for you and for your partner.
Okay, so that's a surgical procedure that does actually help or promote the sexual pleasure. Yes. Our next surgical procedure is labiaplasty. Do you have pictures?
I do.
Is this any of these?
Yes.
So which one?
So there's two kinds of labiaplasty. You can have a labia majoroplasty or a labia minoroplasty. A labia majoroplasty is where the big outer lips are undergoing some kind of surgical correction, and labia minoroplasty is where the smaller inner lips are undergoing surgical interventions.
Is this the major?
This is the minor one.
This is a minor one.
Yeah, so this is a labia minoroplasty. I don't know if you can see the pictures. So some women have the labia minora, the inner lips, be way longer than the labia majora, which is not supposed to happen. And because of that, they tend to have very serious problems in having sexual intercourse, because these very long lips tend to interfere with the sexual intercourse. And other than that, they tend to chafe and get lacerations, and it can be very painful.
It's a large surface area.
It is a very large surface area. And remember, it's very delicate. It's not like our skin here. It's thin, and it's like vaginal. It's like vaginal skin. And so basically, what happens is that other than the chafing and the interfered sexual intercourse, some women are unable to even do things like walking or exercise. Some women are unable to maintain hygiene properly, and so they tend to get quite a lot of infections because the labia are much longer. Some women are not able to keep up maybe with the fashion that they'd like to, so they can't wear something tight. They're not able to wear tights because they get like a really bad bulge. So not all women are doing it just to look good.
For aesthetics.
Yes. And it can happen because maybe you had several vaginal deliveries, or sometimes you're just born like that, or sometimes it can come with aging. So the surgery basically reduces the size of those lips to make it look more symmetrical, more youthful, and more appealing. Actually, yes. So this is the before. Crazy. And this is the after.
This is amazing. I have to put it closer. I'm sorry, guys. Sorry for the graphics. So this is the before and this is after. Isn't that amazing?
You can see how much
that's
better
such a big
it looks,
difference.
right?
Yeah.
And then this is another one. This is the before, and that's the after. As you can see, it's much smaller, and neater. And then sometimes you can have this asymmetrical kind of. So one inner lip is much longer than the other one, as you can see here. And this is the after the surgery. This
is magic. You know what? This is magic and talent. It's like an art.
It is an art.
And she really enjoys it. She really enjoys surgical procedures. She enjoys cutting, fixing, stitching. And they really obsess about it. Like they even draw it. Yes. There's a science behind that they're going to come.
We do marking. And so when you come to the office, we do marking on your dry skin just before the surgery. And then we measure, because we don't want to have one lip longer than the other. We want, complete symmetry. So you do have to have.
Have you had complete symmetry? Have you seen the perfection? A bit of,
a little bit.
But then again, especially if you're a woman, you do feel your fellow woman and you do understand it. That's why you want to really do a good job. So for this surgical procedure, is it for aesthetics and both pleasure, or just for aesthetics?
So this surgery is for aesthetics, but remember it's also for function.
Okay.
So that it's not painful for you to walk, so that it's easy for you to maintain your hygiene. You're able to wash
less
yourself
infections
up. You have less infections. You can put on whatever you like to put on, and so it's aesthetic but also functional. Both just external function but also sexual function as well.
Okay. The next one we have
perineoplasty. Oh wait, we actually forgot the labia majora plasty, which is really important. So basically it's still a labiaplasty, but now we are doing surgical correction of the larger outer lips. And what happens is sometimes with repeated childbirth or aging, you get the outer lips becoming a bit more deflated, a bit saggy, so they're not as youthful looking. And
so do we add fat?
Yes, we do. And so basically what we can do is we can do a small liposuction on the lower part of the abdomen, and then we infiltrate the labia majora with this fat so that they look fuller, and also so that they close up the vagina a little bit, because when they get saggy and thin, the vagina is more open and more prone to infection. So when they get fuller, they protect the vagina from all these infections. And remember, the labia majora are very important in terms of sexual impact. So when they are fuller, then it also, it makes sexual intercourse a bit more comfortable.
Okay, guys. I'm trying to be visual to make it make
sense. So we do something called an autologous fat graft, right? So we remove the fat and we inject it into the area. Or sometimes some women don't want the fat graft; they just want the excess skin removed.
Okay,
so that's another. It's just cut off.
Okay, our fourth surgical procedure.
Perineoplasty.
And tell us what that is about.
So sometimes during delivery, the perineum gets damaged, and these are the muscles that surround the vagina, and the muscles in between the vagina and the rectum. They actually get torn during a very dramatic delivery, especially if the baby is very big, or if there's some kind of problem with the delivery. You can get tearing of the perineum. Now, normal tearing is common during a vaginal delivery, and that's just something that can be sutured, but sometimes the perineum gets completely damaged, and so a perineoplasty is where these muscles are brought back together, and it's usually combined with a vaginoplasty. So we tighten the vagina and we repair the muscles around that area to bring the whole complex back together, so that it's easier to pass stool, and so that women don't get something called queefing. Have you heard of it? Where air enters into the vagina, and then when you stand up, it just kind of escapes and makes this really loud sound.
It's like, I don't know,
and it's very embarrassing,
like farting, but not necessarily
through the vagina. Exactly. And so it can be very embarrassing, very distressing, and so a vaginal perineoplasty can sort that out.
Okay. And this is just for aesthetics and for comfort and functionality.
This is mostly for function.
Functionality. Okay, true functionality. No one gonna. I get what you mean. It's for functionality. Yeah, no one wants to queef.
Yeah.
And it's very embarrassing. Next one is a
clitoroplasty. Sorry, my handwriting is really bad.
I know it's really a doctor's handwriting. Clitoroplasty.
So clitoroplasty is surgery. Most of the time, the clitoroplasty that we do is called clitoral hood reduction. So some women have the covering of their clitoris being extremely long, and it starts to interfere with their function, just like the long labias. So they're not able to keep it clean. They get a lot of infection under that skin that covers the clitoris. They're not able to perform their functions like walking, exercise, and the rest. And sometimes we just kind of shorten that covering, the hood of the clitoris, and we make it a lot shorter. That actually helps in sexual function because it allows the clitoris to get exposed during sexual
so it's
intercourse, so that's not hidden, so that it's more sensitive.
Okay.
But of course, some of the clitoroplasties that we perform are because of female genital mutilation. These are very complicated surgeries because they're generally reconstructive surgeries, and sometimes so much damage has been done and almost the entire clitoral tip has been removed. And of course, it cannot be, we cannot give you a new clitoris, but we can try to reconstruct it, and the remnants of the clitoris, because the clitoris is actually very big. What you see is only the tip. We do have some parts that go to the side, so we can inject certain substances into those remnants that can make it more sensitive. And this is basically what we do for patients who've undergone FGM. Of course, we do platelet-rich plasma therapy for them, which is basically kind of the O-shot, but now a modification because you've had FGM. And then we can inject the same O-shot into the G-spot so that their sexual sensitivity increases. Women who've had FGM have a very low sexual sensitivity, especially if their clitoris has been interfered with. Yeah.
Okay.
So those are the surgeries.
So those are the surgeries. There are 5 of them. And thank you, Dr. for explaining and trying your best to explain.
I hope people understand.
I know people that's try to Google, try to get pictures. We're going straight to your questions because already we're 30 minutes into the live. How much does a vaginoplasty cost?
Okay, so the cost of the surgeries is very dependent on the hospital that you choose. So some may not afford certain hospitals and some might. Then also it depends on the amount of work that needs to be done. So if you feel like you need a vaginoplasty, you need to come so that we can have a look and assess the extent of the work, because the costing is done on the extent of the work and the hospital. So then we'll be able to tell you. It's difficult to just say some women pay very little, some women pay much more. It depends
on the work that needs to be done. So I'd suggest whoever asked that question, kindly book a consultation with a doctor, with a gynecologist, and then they'll be able to estimate and give you a figure. Because hospitals do matter where you're going to, and also the condition and how much work needs to be done. Someone asks, is there a procedure that can help restore or repair clitoris underwent FGM?
Yes, but it depends on the extent of the damage that was done. As I mentioned before, we need to assess how much of the clitoris is left behind. We can give you a new clitoris, but we can make it a bit more aesthetically appealing. And frankly, most women don't really care about how it looks. They care how sensitive it is.
I think for me, it's how sensitive it is. It's not how it looks. But then again, everyone's feelings and
for those who've
are valid.
Yeah, for those who've had severe FGM, they want it to look better.
Yeah, you want to see it.
But you also want the sensitivity. So with that, we can do the O-shot. We can do other forms of platelet-rich plasma therapy around the genital
after the surgery now.
Yes, either after or even instead of. Yeah,
because
for
sometimes
those who don't care about the looks so much. Yeah.
Okay. Another question is, how long does labiaplasty take to heal? Risks and the cost.
Okay, so remember the cost we said depends on the hospital of choice and the extent of the procedure. The labiaplasty should, depending on what you're having. So labiaplasty can either be the autologous fat graft or the excision, where we just remove the excess skin. Usually it takes about 4 to 6 weeks to heal. We expect you to maintain very good hygiene. We give you good painkillers. We give you a laxative so that you don't get constipation. And then as you're pushing, you strain and rip all the stitches off. So we'll take care of you in that sense. The risks, of course, are bleeding during the surgery. The risks are asymmetry, because sometimes that can happen. We may think that we've done it symmetrically. Then after the healing process, we find there's not complete symmetry. That can happen. There's a risk of infection. If you're a smoker, the healing is very poor. If you're a diabetic, the healing is extremely poor, and those are risks that we need to take into account. But basically, as you go into it, we'll let you know all the risks.
And so that you make an informed decision. Another question, which procedure can I have to tighten the vagina after childbirth?
Awesome. So after childbirth, if you were to come into our cosmetic gynecology consultation, we'll assess whether you actually need a surgical procedure or not, because maybe you don't. Maybe you just need the non-surgical vaginal tightening, and you have the EVA treatment, and you're good to go. And by the way, it's extremely effective because it forces your own body to produce more collagen, so you get tightness because your own body made it, not because, you know, we surgically tightened it. However, for those who have extreme laxity and we're not able to do the radiofrequency treatment, then we can do a vaginoplasty for you to cause the tightening.
Okay. Same question: is someone if someone has gone through FGM, can they get a clitoroplasty? You've already answered that. Cost of each procedure, again, Dr. said it depends on the hospital. It depends on the extent of the procedure, the amount of work that the doctor requires to do. So you have to visit the doctor. It's not like you're going to get the surgeries off a shelf. It's not retail business. You're not going to buy from the shelf so you can price it, you know. So these are procedures that the doctor has to estimate. You have to visit the doctor. They have to look at you. They have to see the extent of your condition, and then that can determine the amount of work they need to do and the cost. Location of Dr. Christina's office, I'll let her say that.
So my office is located in Upper Hill, in a building called Fortis Suites. It's opposite Nairobi Club on 6th floor, room 601. And if you can get to us, I think we'll post the contacts. And you can also follow us on all our social media pages. That's Alora Medical Practice on Instagram and Facebook and Twitter.
Okay, guys, keep asking more questions. I think I've gone through all the questions. Do you have more questions? Please feel free to ask more questions. That we can reach you.
Someone is saying a round figure. Well, okay, so basically maybe budget anything between 200,000 and 300,000. Yeah.
Okay.
Sometimes it might be a bit less. Okay. Sometimes a bit more. Yeah. Okay. Roughly.
Okay. When it comes to these procedures, Dr. I think a good point to note is, I think sometimes it's very important to let, for example, if you have a partner, know what you're going through, so that they may understand the reason of wanting to have the surgery. So they can also hold your hand and walk through the journey with you. For example, like you said it can take between 6 to 8 weeks, or even depends 12 weeks to heal. So your partner needs to understand. I'm just thinking about, you've had the surgery and your partner doesn't know what you're going through. I think sometimes, and most times to be honest, it's important to have your significant other understand your condition and the procedure you're going through.
Yeah, it's much better, of course, if you have your partner with you, because after the procedure, for example, a vaginoplasty, when we tell you can't have sex for 6 weeks, you need to be able to explain why to your partner why you're not able to have sex for 6 weeks, and how you can kind of go about it together. You need to be very delicate. Your hygiene might need to change. You might be on a sick off the first 2 weeks after the procedure. So all these things, it will be better for your partner to know. Of course, it really is up to you.
It's really up to you. Sometimes it depends on just how relationships work. But even if you don't tell your partner, it's good for someone to know, to support you and help you. Because I feel like sometimes the healing process is more than just a natural process. It also requires a positive mindset, someone who understands you. So I think it's important to not walk this journey alone. Another question someone asked, O-shot, please explain.
Okay. So the O-shot is a form of platelet-rich plasma therapy. Platelet-rich plasma therapy is a therapy that has been used for several years in sport medicine, in cardiology, in dermatology, for hair transplant. And what it does is that we take your blood and we separate it into red blood cells and everything else. And everything else has platelets, has stem cells, has growth factors, has substances that remove infective agents. And what a stem cell is, it's a cell that has no assigned role in the body. So when it's placed in a particular area, it checks what are the surrounding cells looking like, and then it becomes that cell. So for example, if we put the platelet-rich plasma therapy solution into your clitoris, the stem cells in that area will recognize other clitoris cells and they will become clitoris cells, but they'll become healthy, rejuvenated, clitoris cells. And so when platelet-rich plasma therapy is placed into a particular area, it causes new blood vessels to form, it causes the nerve endings to become very sensitive, and this is exactly what we need to be able to enhance sexual function. And so the O-shot is where we take this platelet-rich plasma therapy, platelet-rich plasma, and we inject it into the G-spot and into the clitoris to make them more sensitive, to make new blood vessels form, to make the nerve endings more sensitive, to increase lubrication, to remove pain. So it's the body's way of regenerating itself, and it's a really good therapy for those who've had FGM and their sensitivity around that area has decreased. But even for women who just want to do it to increase their sexual pleasure just for fun, not because they have any kind of female sexual dysfunction, but just to enhance it.
Okay. Someone else asked, can you touch on incontinence as well?
Okay, so incontinence, I'm going to touch on it in terms of the non-cosmetic aspect. The non-cosmetic aspect comes in when you have stress urinary incontinence. This means that when you pee a little bit, when you cough a little bit, you tend to pee. When you laugh a little bit, or when you have to strain your abdomen in any way, a little bit of pee inadvertently escapes. And so we do have a non-surgical treatment when your incontinence is mild to moderate. We have a radiofrequency treatment that is able to treat that very well, which is the EVA treatment. Please find out about it at Alora Medical Practice. But if your incontinence is severe, you do require surgery, and you will require a urogynecologist to perform that surgery. It is not a cosmetic surgery. It's a urogynecological surgery to help the person stop inadvertently passing urine when they do not want to. It's actually quite, it's a serious surgery. You need to see a urogynecologist. I'm actually not a urogynecologist. So for my patients who have severe stress or urge urinary incontinence, I usually send them to a urogynecologist.
Okay, I hope we answered your question. Can the pelvic floor be repaired?
Yes, it can, and that's part of the perineoplasty. Perineoplasty is pelvic floor repair, where we repair the pelvic floor muscles, and most of the time we do a vaginoplasty in the same sitting. It can be repaired.
Okay, so that can be repaired. So I always say women, you do not need suffer in silence. All these procedures are available in Kenya. Help is out here. It's just a matter of being confident enough to go and see a doctor. The good thing about them, they have what is it called? The wood shade. What is it called?
No, confidentiality.
Yeah. So don't be afraid, don't suffer in silence. Please clarify radiotherapy for collagen.
Okay, so radiotherapy is not to be confused with radiofrequency. Radiotherapy is for cancer treatment. Radiofrequency is a heat energy that makes your body produce more collagen. So radiofrequency can be used for facial therapies, like for those who have wrinkles, for those who want to make their facial skin better, plumper, have more collagen and tighter. And so the same radiofrequency is used for vaginal treatment to be able to make a tighter vaginal barrel. So what it does is that it makes the deeper layers of the vagina produce more collagen, and when the deeper layers produce more collagen, they come together and they make the entrance and the entire barrel of the vagina much narrower. So it's radiofrequency therapy for vaginal tightening. For we also have it for vulvovaginal atrophy, the symptoms women experience during menopause. We also have it for incontinence.
Okay, but if your incontinence is mild to medium,
yes, to moderate. Mild to moderate only.
Okay.
Yeah.
The myth with Ugandan, the myth with Ugandan women pulling their labia for better sexual.
What's the question?
So is it a myth? It's true. I think
they do.
There's even a documentary for Rwandese women when they're young. Go watch a documentary. Yes. I've seen it. I don't know. I can't tell you if it was on Netflix or, but I've seen it where Rwandese women from the time they're small, they're taught to get a friend and they pull each other's.
Labia. Yeah, it is done.
Is there any scientific?
I don't know if it increases sexual pleasure or not.
Mm-hmm.
It is a form of FGM, by the way.
Is it?
It is.
Okay.
It is a form of FGM.
Mm-hmm.
But the thing is that I'm not really sure what the purpose is. Okay. Yeah, and it's not a medical procedure, so I'm not able to answer that.
Okay. Also, how much is it, and at what age can you get it?
You can get it at any age that you want to enhance your sexual function. You can get it after having your baby. You can get it in between having babies. You can get it at any point you feel like you want to enhance your orgasms or increase lubrication or remove painful sexual intercourse. But first, the painful sexual intercourse needs to be diagnosed, because maybe it's just endometriosis, or maybe you have a fibroid in your cervix, or you have an infection in your vagina. So you need to know that it's not any of those. And then when no reason has been found, then you can have an OSHOT. By the way, you can get more information from the OSHOT website. They have lots of information there, and they have all the listed providers all over the world, including Alora Medical Practice in Kenya. The cost in our clinic is 80,000 shillings for the OSHOT.
Okay. Which insurance companies do you take? Someone asked Aeon. Do you take for consultation? I think this is the initial consultation.
So for consultation, actually, please contact our clinic. They'll give you all our insurance partners, the ones that we accept for consultation. Please also remember, cosmetic procedures are not covered by
necessarily
insurance.
covered by insurance. So it depends. It depends on the type of insurance. Also depends on the type of procedures. But I know cosmetic procedures are not covered. If right now we are doing a pandemic, COVID, and they don't give you vitamin C,
they're not covering a pandemic.
Yeah, they're not covering a pandemic. Even vitamin C, they'll give you everything else, but you have to buy yourself vitamin C. Yeah. Keep questions coming. We have another 10 minutes before we finish the live. Dr. is here. Take advantage of her and ask as many questions as possible. Remember, today we're talking about surgical procedures. We talked about 6 of them. I'll let Dr. say the 5 of them again because of my pronunciation.
Yeah.
Some are for surgical reasons, some are for functional reasons, some are for aesthetic reasons, and some are for functional reasons. But at least we were able to go through all the 5 of them, and she was able to give you the basic procedure around it.
Yeah, so basically talked about hymenoplasty, which is a surgery to restore the hymen. And then we talked about vaginoplasty, which is basically surgical tightening of the vagina. And remember, there is a non-surgical option for that as well.
The EVA
treatment. And then we had talked about clitoroplasty, which is reconstruction of the clitoris surgically after either trauma or FGM. And it mainly involves reduction of the covering of the clitoris, the hood, but in some cases we need to actually operate on the clitoris itself. Then we discussed perineoplasty, which is bringing together of the muscles of the perineum or pelvic floor repair. And then I think there's also vaginoplasty and labiaplasty, where we discussed the labia majora plasty, which is where we either excise the excess skin that may have formed, or we do a mini liposuction on the lower abdomen and inject the labias with fat to make them fuller and more youthful looking. And then we have a labia minora plasty, where the labia minora are very long, much longer than the majora, and they hang below the majora, and so we can basically surgically correct that for them to be in line with the labia majora and have a more symmetrical and aesthetic and appealing look, and also increase functions such as hygiene and sexual intercourse and exercise and being able to wear certain things.
Okay, so that is our topic for today, surgical procedures. We have another 5 minutes before we finish our live. We see more questions.
Someone is asking if we take Aeon for consultation. No, sorry, we don't.
Okay, they don't.
But actually, to mention, for the consultations, for those who have insurances that we do not accept, you could still come, and yes, we'll attach a receipt to your claim form, and you can claim from your insurer a refund.
Okay.
And many of them are usually quite prompt in refunding for that.
Okay. I hope you guys enjoyed the live. It's engaging and we've answered your questions. This is a topic that requires a lot of visual presentation, which we weren't able to do today. But just to let you know, guys, it's possible to have these procedures in Kenya. Dr. is there, her office is there. I'm sure there are other gynecologists who do it.
Yes, there are 2 other cosmetic gynecologists in Nairobi. Some gynecologists do some of the procedures, even though they may not be cosmetic gynecologists, but they still do the procedures.
Okay, so we have options. Don't suffer alone, like I always say, information is power. I think there are a few more questions. My people write for me, then we can answer, and then we can close for today.
Someone is asking, how much do we charge for consultation for gyna checkups? We charge 3,000 shillings.
And are you guys have you taken your pap smear, your mammogram this year? For ladies like me who are above 35, have you done your ultrasound? I've answered the consultation. And I always say it's good to talk to your friends, your relatives, and even your best friends about these things, but make sure you go see a medical professional, because some of these things are not things that you just make an assumption and diagnose yourself, but you know what, I need a vaginoplasty. I'm like the doctor needs to check.
Yeah, and actually some people, when you come in, we do a good assessment and we check, do you actually need the surgery? Some people have something called body dysmorphic disorder, but they feel like they need a surgery, they feel like they need to correct their appearance when they actually don't, and it's perfectly normal. So that's why you need to see a doctor before you make that decision.
Yeah. Somebody said we look great. Thank you very much. Yeah, I always say that Daktari looks with her makeup and her lipstick and her nice outfits. She looks like she didn't go to theater and cut. I'm telling you, that is what she enjoys. She enjoys the cutting. She enjoys surgery. She enjoys the symmetry. She enjoys putting it together. If you look at her phone, if you ever get Daktari's phone, I'm telling you, don't even try to look at her pictures. You will be shocked at the things she looks at. Yeah. So is there another question? Thank you very much for your lovely comments. Ingrowth, how do you deal with ingrowns?
I'm guessing you're talking about ingrown hair?
It's ingrown hair. I think what has worked for me is laser. Laser has really worked for me, and when we talk about laser is a continuous process, and you have to only do laser alone. What women tend to do is you do laser and then you mix it up together with waxing, then you're going back to zero. So it's only laser, and the thing with laser that I found out is that it doesn't give you that clean look that waxing does. But over time your hair becomes thinner, you have less ingrowths, and for me it has also improved the discoloration around there, also plus what we did. So I can see I'm maybe 3 shades later than I was, so laser does help. And like I said, you cannot mix laser with anything else. You cannot mix it with waxing. What do you think like that?
I'm gonna take your advice on that one.
Because me it has worked.
I know.
I just can't show you a visual, whatever, but it has worked.
Yeah, I don't get too many people with ingrowns actually. Sometimes I get like a hair root infection, which needs to be treated with an antibiotic. But if it's continuous ingrowns, then I do trust your opinion on that. Yeah, and Dr. Stash does that a lot.
So, but people ask me, how do I get my laser procedure? I do it at Dr. Stillman Stash's office, which is at Riverside Drive. That's where I do my laser. I do it once a month. And to be honest, I've seen that the hairs, especially the hairs at the top here, they are very thin. What I'm struggling with is the hairs around the lips. Those ones keep growing, and it's tougher for them to become thinner. Yeah. Oh, someone said laser is their all-time favorite. Worth getting yourself one. That's true. Laser, I didn't know about it, but laser is, for me, it has really worked, and I'm also glad to know that when I age, as my hair gets white, my hair down there is not going to get white. That's something that laser assures, man. You know, I can't have white on my head and look all. I'm joking. It does do gray, but then I'll tell you, when it starts graying, it grays everywhere.
That's true.
So my people here are laughing.
Get laser at Dr.
And you cannot dye. I tried to me a dye cochini, which is this dye our moms used to use on the head. If you know that dye that was bought, what was it called? The dye, guys. You know this dye that my parents used to buy for 20 bob. Bigen. Remember that dye? You cannot dye down there, people. Somebody's laughing. Yeah. You cannot use dye down there.
Sure.
So try laser, guys. It's once a month. You save up for it, and for me it has really, really helped, especially with the hyperpigmentation that comes with hair removal. Oh, guys, we're nearly done. We have 5 minutes to finish. Thank you guys for joining. Thank you for taking your time, your evening, to join and get informed. So see? Voila. Thought the hair down there remains black. No, my friend. Graying happens everywhere. It happens here. And people are using down there like me. Use the word. Don't be old-fashioned like me.
Ban that one.
Down there. Okay, give us a word.
Just call it what it is.
Which
the
is?
Vulval hair.
Oh, the vulval perineal.
Pubic hair.
Okay, fine.
Pubic
Well, I'm
hair,
sorry.
right?
I told you I'm the kids born in the 80s, people. I'm really trying. Any other questions? Someone says, changes to grey. This platform is always informative. That's my aim. That's my goal. It's usually to inform, to educate, so that we can learn. I believe we always learn. Always, to be honest, I learn new things every day. So you have to have the mentality of learning, and we also learn from each other.
Yeah.
Because we all have different experiences, and they don't feel shy about sharing, because you might be helping someone out there. I think that actually we've had so many cases of women who come and they bring you to tears.
So many, and I know those problems are real, which is why your insurance questions are really valid, because insurance should
cover for some of these
such things. Because if you have sexual dysfunction and your relationship is breaking down, it bothers you.
It does.
So I feel like cosmetic surgery should be covered, but so far, unfortunately, it's not anywhere in the world actually. Yeah.
Someone asked how much is laser. On top of my head, I don't know. I think one session is between 50 and 20,000. And is it painful? You just feel a sensation. What I feel is quite sensitive is between the lips. Is that the labia? Yeah, that's why it's quite sensitive. For me, that's where they have to reduce the frequency to a very small frequency.
That's why the hair keeps growing back.
Yeah, because it's not. But the rest up there.
Yeah.
So it's up there down there. Look at me. They are good to go. It's up there. Yeah. So it's a sensation, but it's not painful. It's not painful. I'm going to improve, guys. Is it painful compared to waxing? Can you talk about your
nipples? Oh my god.
Your nipples. I really, to be honest, it's less painful than waxing. But I told you that waxing gives you that nice smooth look. Laser doesn't give you that. But over time, it will get you there, because what we are doing is we are making the hair thinner and thinner as we go along. Someone talked about your nipples. I'm not in the position. Actually, your nipples.
Do not use your nipples. Please don't use your nipples. Nobody knows what the contents of your nipples are. There's no regulatory body that forces the producers of your nipples to tell us what is in them. There's no regulatory body to regulate the adverse effects of your nipples. And then I'd just like to ask, what is the purpose of your nipples? Because if it's tightening, there's procedures for that, as we've just
It's
discussed.
not like I can't say I've never purchased them from the UK. I have. But
what do they really do?
It's like it's in a white netish thing, and then the thing that you have to have it. For me, the most difficult part was this: you have to have it in for 72 hours. There's no way I'm going to susu and then I'm leaving that thing inside for 3 days. That was my biggest problem. So I've tried it, but I didn't even finish a day because I want to remove it. Like if you can, if it's like and a tampon you remove all the time, but for me that was the biggest challenge. But I don't know what is the science behind it.
If it's cleansing, the vagina does not need cleansing. It cleanses itself. Okay. The number of your nipples I've had to remove that were either forgotten or refused to come out or caused an infection.
Refused to come out?
Yes.
Okay, please it's not worth it. Refuse to come out. Kwani how far
the patient comes to my office and tells me they've used their nipple. I just want to run away, honestly.
Yeah, so zimekoma huko ndani. Asitoke. Yes. Okay, which soap should we use on the vagina for cleaning?
Okay, so you can use your general bathing soap. Do not clean inside the vagina. The inside of the vagina does not need any kind of cleaning. It cleans itself. You can use either the soap that you use to shower, or you can use a vaginal wash like Lactacid, Vagisil, V-Wash, whichever you like.
Was good, but has disappeared from the market. I've used it for many.
Yeah.
It's amazing. And whenever I hear it's there, like I'll go and buy like 4 or 5 bottles. Yeah. But like the Charlie said, you don't need to clean the inside
your vagina, please.
Okay, guys, I think we'll call it a day. Thank you so much for engaging. Thank you, Rachel, for being here.
Thank you so much for having me.
You're most welcome. And I've also learned something, all these procedures. And you know me, how I like research. And I'm determining which one should I have. I'm joking. So for now, all I have done is O-Shot and Eva. And for me, I will not lie, Eva gave me very, very good results in terms of lubrication, in terms of sensitivity, and I can say it allows you to have, it's for functionality, comfortable sexual activity, sexual pleasure, and it's something worth trying. And what I liked about it is that it is reawakening my nerves. It's actually making them function, or making that area function the way it's supposed to. So I'd suggest save, like everything else in this world, save, go to the site. Dr. Ari is one of the doctors who are approved to do this kind of treatments, and go for it. The same way you save for buying a wig, same way you save to travel. We need to take care of our reproductive health and to ensure that we do have maximum pleasure when it comes to that. Dr. Ari, you can finish.
Thank you so much, everyone, for joining. I hope that surgical cosmetic gynecology is now something that is a bit clearer to you. If you need it now, you understand a bit more about it. If you don't need it now, you know you don't need it, which is perfect.
But when you do,
you know also now where to go. So thank you so much for joining. We probably will do another live on non-surgical procedures, so that we can make it a bit clearer, what's available in the market. But thank you so much for joining, and please keep watching.
Yeah, please keep watching. Let us know what you'd like us to talk about, and I can't wait for another person that is coming up with. I can't wait. I'm always ready to have all of them. Yeah. So until next time, guys. Bye bye. Have a lovely evening. Thank you.